we had a meeting that I went to where a chiropractic doctor was. They actually have a machine, I guess, that can target that area. Are we talking about the lymphatic system and as that part of the brain, or what fluids right now, when you get that kind of a concussion, are being blocked so that our audience understands that?
Sure.
And how does that impact the brain?
Sure. It's the flow of cerebrospinal fluid. And
Okay.
so
CS.
ultimately, lymphatics will get affected, but the main vessel that's involved here is the formation of the cerebrospinal fluid, which the brain makes inside the center of it. And these structures called the ventricles, they're basically caverns. And inside those caverns, the amount of blood or plasma from the blood that gets across what's called the blood-brain barrier dictates how much CSF, cerebrospinal fluid, the brain will make in those ventricles. And then the equivalent amount that's made has to drain through the upper neck in order to keep a balance or equilibrium of how much is made to how much is drained. Because if you make more than you drain, that means that you continue to make and it starts to pool in the brain. And what ends up happening as a first course of events is that the ventricles will swell out a little bit. And as they start to swell, they start to seep out some of the cerebrospinal fluid into the brain between the skull and the actual brain. So you have what would be termed hydrocephalus, but it's rarely diagnosed as such. And so, but it does cause pressure on the brain, which can result either in cognitive, difficulties and or just a simple headache or constant pressure in the head or pressure in the ears or, blurry vision. It can cause a gamut of things that aren't truly being caused by a defect in the brain, but it's caused by a backpooling of fluid that the brain is making as a result of our blood circulating nonstop and forcing then plasma across the blood-brain barrier. And then the ventricles make an equivalent amount of CSF as to how much plasma has been introduced to them. And then that has to go into circulation. And if more is made than is drained, you get a backpooling, and you can get a whole gamut of problems. And, in a long-term, trajectory pattern, if that is long enough standing or recurrent enough that it repeats itself often enough and frequently enough, you can actually get hypoxia or a reduction in oxygen and nutrients to the adjacent brain tissue that's right outside of the ventricles. And so an example, you'll see that when people get discovered or they get diagnosed with multiple sclerosis, inevitably, if you track the research, the vast majority of their so-called white plaques are periventricular, which means they surround the ventricles, which would pose the question of, is that because these ventricles are swelling because of this phenomenon that I just explained, causing then those adjacent brain tissues adjacent to the ventricles to be squeezed a little bit and voided or devoided or reduced in how much oxygen perfusion gets to those tissues, and they go into a different metabolic state, which can change their appearance on an MRI from gray to white or whatever the signal sequence is that they use it on MRI. So it'll show up as a sclerotic plaque. And the assumption that I always had is that that's dead brain tissue. Well, research has shown that if you can alter the fluid dynamics, some of those white plaques will dissolve and disappear. And does that mean that they were dead? That likely means that they were in a hibernative state, causing their morphology to change, which gives them a different appearance. And then if you reduce the hydrostatic pressure on them, they get more oxygen and nutrients back to them, and they go out of the hibernative state and start metabolizing properly and change their color into what we would expect to see on an MRI scan.
So you're saying that, does this start at the neck? Because we know that when you have a concussion, you have inflammation, you have swelling, and in very, very pronounced cases, then you have that edema, you have that really that buildup in brain where they have to drill holes and relieve pressure.
Yeah.
You're talking about the same type of phenomena where you have pressure within the brain causing cognitive and behavioral deficiencies that's stimulated by damaging the neck muscles.
The neck ligaments.
The neck ligaments. Okay. All right.
So then the only recourse that the upper neck has then to maintain a proper alignment and stability would be the muscles. And the muscles can't invariably hold on to that amount of work and forces long term. And that's why we have ligaments. Ligaments hold our joints passively together, whereby there's some amount of movement, but not too much. And so, for example, when you sprain your ACL in your knee or tear your ACL, now your knee is deficient. It actually moves too much. And so the only worst problem that you can, have happen there is that eventually you'll have degenerative arthritis where they got to replace your knee. Well, when that happens anywhere in the spine, the spine's number one job is to protect the spinal cord and brainstem, and the skull's number one job is to protect the brain. When you have an infringement upon that capacity to protect, the thing itself that's supposed to protect can now be the thing that encumbers. So when you have too much movement between two spinal bones, those actual spinal bones that are intended to protect the spinal cord will now irritate the spinal cord because they shift too much. And they nudge up against the spinal cord, and any even hydrostatic pressure, so them just displacing fluid, which is a viscous fluid inside the canal, can actually displace the spinal cord. So you don't have to have physical contact of the bone on the spinal cord. You can just have an excessive pressure or displacement of hydraulic fluid in there that will stimulate the spinal cord, or in this case, the upper spinal cord, which is the lower part of the brainstem. And then you get what would be called cervicomedullary symptoms, which are, anything that the vagus nerve basically is involved in. So heart rate, blood pressure, temperature control, breathing rate, vision, hearing, the transmission of bowel movements, stomach acid, even some reproductive things are governed by that. And that's just to list a few.
So in your estimation, given the fact that, neck ligaments are, pretty much, well, I'd say the neck, right? Whether it's a concussion in football, hitting a soccer ball, being tackled violently in rugby, or, getting checked in hockey, right? Your neck is always at risk. I'm a front or row prop. I'm a tight head prop in rugby. And, that's why I got turtle. Everybody calls me the turtle. I have no neck, right? It's just I got a neck and I got a shoulder. So, what, in your estimation, how common is this injury in our athletes? Because everything that we're talking about that impacts the head impacts the neck. You can't get away from it. So, this seems like there could be a fairly common injury that is not being diagnosed when especially when we have a concussion.
Yeah, I think it's an extremely underdiagnosed and undiagnosed condition. I think on a daily basis, I'm so incredibly shocked to find out how many people out there have a variation of this condition, if you want to call it, and that would be dictated by the severity of their symptoms. But the percentage of people out there walking around, and it's not just from sports, is massive. I think it's the most massively underdiagnosed phenomenon as it relates to the concussive, the global concussive phenomenon, if you will. A concussion is I think a very vague term that assumes that it's all brain.
Too vague. Yes, sir. Yeah. We spend so much money. Yeah.
The frequency and the prevalence of this upper cervical, ligament damage to some degree and some variation is ginormous.